The gentleman from Arlington, Mr. Hope.
Thank you, Mr. Speaker. I rise for an announcement and a point of personal privilege.
Gentleman may proceed.
For the announcement, Mr. Speaker, ladies and gentlemen of the House, one of our colleagues has a birthday today. And this time I'd like to recognize the gentlelady from Newport News, Delegate Robin Abbott. Wish her a happy birthday. Point of personal privilege, Mr. Speaker.
The gentleman may proceed.
Thank you, Mr. Speaker. Yesterday, in the House Finance Committee, I had a bill that was defeated or laid on the table, House Bill 1815. Now, the bill has gone away, but the issue hasn't. Governor McDonnell came to this chamber a week ago yesterday, and he cited that the Medicaid budget has grown an unsustainable 1,600% over the last 27 years. That's just incalculable to me. I can't understand how we've let our Medicaid budget go that far. My bill would have slowed the growth of Medicaid, Mr. Speaker, and it would have saved taxpayers money. If we do nothing to address our Medicaid budget, we're going to continue to go at a trajectory that is just unsustainable, and our Commonwealth will go bankrupt. My bill would have also provided adequate reimbursement to physicians and hospitals and nursing homes who are scheduled to go from 72 cents last year on the dollar to 60 cents on the dollar. How can you stay in business, continue to see patients with those kinds of rates? The bill would have also eliminated our ID and DD waiting list. We have currently nearly 6,000 people waiting for services on that list. This bill would have been able to eliminate that list, which is a priority of the General Assembly. It would also prevent children from smoking, and it would help encourage adults to stop smoking. Now, Virginia's Medicaid program is facing a fiscal crisis. We have to do something about it. The budget is unsustainable. No one argues with this, but we have to do something. Medicaid, back in fiscal year 1985, represented about 5.4% of our entire Medicaid budget, our entire budget in the Commonwealth, 5.4%. Today, fiscal year 2012, it's over 21% of our budget. That's what 1,600% over the last 27 years does to your budget. Reimbursement for hospitals and doctors are going to be cut. Doctors will be forced to turn patients away just to keep their doors open. Some will continue to take Medicaid patients, but most others will not be able to accept new ones. And we continue the antiquated policies that emphasize expensive institutional care away from less costly home and community-based care. All this adds up to decreased access to care for Virginians, costly emergency room visits, avoidable hospitalizations, and expensive services that we pay for people with disabilities when they could be served in the community much less expensive. Now let me just spend a second on the hospital and physician side, because I think this is really critical for people to understand what we're doing. And I've cited this example before, but you can cite it for a number of different disabilities, whether it's diabetes or heart disease. If you can't go see a doctor, Mr. Speaker, ladies and gentlemen of the House, you're not going to abuse the system. You're going to wait and wait and wait until you can't wait anymore and end up in the emergency room. We give our podiatrists, who I believe are here on Capitol Square lobbying today, we give them a hard time for just a certain level visit for a patient checkup, to check a patient with diabetes, their feet for circulation. But yet Medicaid seems to have no problem paying for a foot amputation or a toe amputation or a leg amputation. And so we need to change the incentives in order to save Medicaid. But we're not going to do it by cutting hospitals and doctors. That is not going to get us to slow the growth of Medicaid. My bill would bring that up from 60 cents, which is proposed, to approximately 76 cents, which is about the average that it's been over the last decade. And I don't need to tell you that with the Affordable Care Act, we're going to see 400,000 new Virginians become eligible for Medicaid. But we have no doctors, no plan to make sure we have a place to see them. Now, if we do nothing, we'll still have a problem. But this is going to compound the problem even more. On the IDD waivers list, we rank nationally 45th in the nation of what we provide for people with disabilities. 45th for Medicaid in the nation. And yet, the administration recognizes this. They recognize the problems. The governor has put in his budget 275 new waivers on the waiting list. But yet, what we seem to be doing is we're planning to downsize our training centers. Parents that are in the training centers are concerned about what the services are going to be like outside. We're cutting rates for residential services. So on the one hand, we're putting in more waivers for people to go into the community, but then we're cutting community services. It's backwards. It's backwards. And we need to reverse that. And there's no pathway, Mr. Speaker and ladies and gentlemen of the House, no pathway whatsoever to deal with that waiting list. In 2009, the gentleman from Colonial Heights should be certainly recognized for his strong commitment and firm belief that we eliminate the waiting list. And I share his concerns and applaud his efforts, and many people in the General Assembly, but he led the charge. We are on no pathway to do that. In fact, if you look at this as like a credit card, we're not even paying the interest on this credit card. We're not even moving in this direction. This bill would address that and eliminate it entirely. The other thing that the bill would do is put money on the table for smoking cessation programs to get kids and adults to stop smoking. But it's no surprise. It's no surprise that today the American Lung Association just released a report card of Virginia and gave Virginia Fs across the board. An F in tobacco prevention and control spending, an F in smoke-free air, an F in cigarette tax, an F in smoking cessation, an F. We got that because we ranked 50th in the nation in our smoking cigarette tax. 50th in the nation. Missouri is lower than us. To pay for all these initiatives, to pay for these priorities, to make sure we have doctors, to make sure the hospitals can keep their doors open, and nursing homes are able to care for people, to pay for the eliminating the waiting list. I propose a cigarette tax or user fee that would bring us to the national average. We'd go from 50 to 25. Not the highest, but not the lowest. And I would submit to the members, ladies and gentlemen of the House, that one of the reasons why we rank 45th in Medicaid funding is because we rank 50th in our tobacco tax. And we'll continue. This will bring in $599 million a year if we were to enact this. And don't just look at it as $599 million, because when we put it towards the things that I'm proposing, I'm suggesting, we double that. How? The federal government will match dollar for dollar. So $599 million would become over $1 billion every year into our Medicaid budget to take care of priorities that this chamber, this body, has agreed are absolutely critical and crucial. The other thing that it would do is it would prevent nearly 74,000 kids from becoming adult smokers. Our annual health care expenditures alone for tobacco use is nearly $2 billion a year for everyone in Virginia. $2 billion tobacco-related illnesses. That's all kinds of cancers, heart disease, and diabetes related to smoking use. And just Medicaid alone, it's $400 million. People who are on Medicaid that choose to smoke are costing taxpayers $400 million every single year. This bill would get them to pay for what they're costing taxpayers. So, Mr. Speaker and ladies and gentlemen of the House, when you take a look at your tax, your W-2 form, and you see the federal tax, where your taxes are going to the federal government, you should realize that a lot of other states are getting your tax, your money. You're paying for other states to serve their needs because we're not getting the Medicaid, the dollar-for-dollar compounding aspect of Medicaid budget. When you look at your state tax, people who choose to smoke are costing Medicaid even more. Now, we could choose to do nothing, but I just don't think that we can afford to do business as usual, because going at 1,600% over the last 27 years and no plan to slow the growth, and I have yet to hear a plan from anybody of how we deal with slowing this growth. This bill would actually do that. I tried, Mr. Speaker. I tried, ladies and gentlemen of the House, to slow that growth because I think it's very important that not just the disability community, not just the providers, every single Virginia taxpayer should be concerned about 1,600% over the last 27 years with no plan to deal with it. This puts us on a path to do that. And I would say to any member who doesn't like how I pay for it, I would love to hear an alternative. I would love to hear another idea. People talk about people poking holes in arguments and not coming up with a suggestion. This is a serious one. This is a fair one. It's a fair conversation to have. How do you pay for these priorities? Are we serious about eliminating the waiver list? Are we serious about making sure that we have providers to care for people? That's the question for the body that I pose. But I would like to help with a solution. And if anyone has a better one, I'd certainly like to hear it. So with that, Mr. Speaker, I appreciate your indulgence. I yield back.